This is the 11th in a series of videos about the business of the eyecare service. Module 11: Safeguarding and Protecting Children and Adults at Risk. This video introduces the concept of child and adult protection and safeguarding. After watching the video, or by pausing the video, you should discuss the concepts with all eyecare service staff to understand the relevance to your service and to identify areas to be watchful and that may need changed within your service. This is a chance to learn from each other, and you would be required to do some further self-learning after the session. The learning outcomes are to know the difference between safeguarding and protection, to recognise what visual impairments and other barriers may cause vulnerability, to understand your responsibility, and to have confidence to raise and report concerns. The following is an exercise for a short, full group discussion. So firstly, what could make someone at risk of harm? Whilst personal characteristics may make an individual more vulnerable, for example, disability and communication difficulties, it is the situation around an individual which may increase risk or place them at potential risk of harm. It is therefore vital to be open to the possibility that any adult or child may be at risk, and that this can be temporary or ongoing depending on the support and protective factors around them. Second, what factors could make a person, adult or child, with a visual impairment be at risk of harm? They may need help with personal care, risk of falls and injury, unable to read important documents and bills, have trouble using money, the community do not understand, they could become isolated, depressed, more reliant on others to help. Family members may become stressed with extra responsibility. 3. What injuries that have caused vision loss could be a protection concern, adult or child? Remember, abuse is not acceptable in any country, so even if it is accepted to smack a child, it should not cause an injury. Also consider lack of eye protection in the workplace. And 4. What factors could cause an imbalance of access to eye care? Discuss poverty, lack of education on eye health, sensitization of spectacle wearing, distance to vision clinic, parental concern or lack of understanding, traditional forms of healing such as faith healers, gender, disability, location, being dependent on others to access services. As you can see from this slide, there is a vast range of vulnerable groups. Take some time to consider each one on this slide. An individual may relate to more than one group at the same time, or move from one group to another. There are many types of abuse. Take some time to consider each type on this slide. An individual may be subject to more than one type of abuse at the same time. Remember that the victim can appear defensive in giving an explanation of their injuries or may not be able to speak about them due to being scared or threatened. They may also cower or flinch when approached. It is important to stress that victims and perpetrators can be of any gender and any age. In the next few slides, we will be looking at what the terms safeguarding, child protection, child participation, and adult at risk mean. Again, you should hold your own group discussion to learn from each other and understand better. Safeguarding is the responsibility of organisations to make sure their staff, operations, and programmes do no harm to children and adults at risk, nor expose them to abuse or exploitation. Although it is the responsibility of each individual to abide by safeguarding policies and principles. Child protection is part of the safeguarding process. It focuses on protecting individual children identified as suffering or likely to suffer significant harm. This includes child protection procedures which detail how to respond to concerns about a child. Adult protection is similar. Article 12 of the United Nations Convention on the Rights of the Child recognises that children have a right to be heard and to be taken seriously. So you can ask a child if they want to wear glasses, even if their parents are reluctant. An adult at risk is any person who is aged 18 years or over and at risk of abuse or neglect because of their needs for care and support, and or are unable to safeguard their own well-being, property, rights, or other interests. The aims of safeguarding and protection are to stop or prevent harm and reduce the risk of abuse or neglect, to support adults to make choices and have control about how they want to live, to promote improved outcomes for children and adults at risk of harm, to offer accessible support and information, to demonstrate accountability and transparency in safeguarding policies and practice. It is your responsibility, whatever your role in your clinic, to prevent abuse where possible. If you either suspect abuse or it has been disclosed to you, then you must report and record it. The following is a full group discussion exercise. Scenario 1. You are working in a paediatric clinic and a child attends without an adult. Your colleague takes him or her into a side room to do an eye test. Does this scenario fall under safeguarding or child protection? Would you report this? Who to? How? What policies will assist you? What should have happened? So in this scenario, safeguarding is the relevant concern. You should refer to your organisation's safeguarding policy on how to report, inform your supervisor or manager, and keep factual records. Follow the safeguarding policy, whistleblowing policy, and code of conduct on how to practice safely. What should have happened is to have a nurse or receptionist in the exam room, or leave the door open, or do the exam in an open area, and always reassure the child. Scenario 2. Whilst examining a child's eyes, you notice bruises or an eye condition that could have been caused by him or her being hit. So again, is this a safeguarding or a child protection issue? Would you report this? Who to? How? What policies will assist you? What actions would you take? So in this case, we are talking about child protection. Gently ask how it happened using open questions, but do not interrogate. Refer to the organisation's child protection, or adults at risk if an adult, policy on how to report. Follow child protection procedures and pathways, and inform your supervisor or manager. Do not make promises of keeping quiet. Do not investigate. Keep a record of injuries and what was said and what and when you reported. Keep records factual. So you should be recording what you saw or what X told you, rather than what you think or that this could have caused this, etc. A woman with very poor eyesight cannot afford to buy spectacles. A colleague assists her home. She comes back later with the money to buy the spectacles. Safeguarding or protection. Would you report this? Who to? How? What policies will assist you? So this is a safeguarding issue. Safeguarding policy should be in place to prevent this from happening. Also, code of conduct. This could escalate to protection, as the woman may be at risk of harm, so you need to report it as indicated in your organisation's policies, usually to your manager. The safeguarding whistleblowing policy and staff handbook will assist you. Next scenario is a man with a disability attends an eye clinic with his care provider. Whilst doing the exam, you notice the carer seems to enjoy bullying and making fun of the man when he is unable to read the chart. Safeguarding or protection. Would you report it? Who to? How? What policies will assist you? This concerns protection. Report in line with your organisation's policies and procedures and national guidance, usually a supervisor, manager, or protection officer. You should keep a vulnerable adults or adults at risk policy, a safeguarding policy, and a staff handbook. Follow the policy and national pathway guidelines. Do not make promises of keeping quiet. Do not investigate. Keep a record of what was said when, of what, and when you reported. Keeping your records factual. How to report suspected abuse. Note signs and symptoms without alarming the patient or alerting a possible abuser. Do not investigate, but listen sympathetically should the patient talk to you. Use open, non-leading questions. Do not agree to keep what they have told you a secret. Alert your manager or designated person. Make factual notes and keep records, include dates and times. Follow your organisation's safeguarding and protection policies. Reports should be restricted to the nature of the injury, suspicious behaviour or concern, facts which support the concerns, dates and times, advice and actions. You and your manager or designated person must agree what the patient, relative, or guardian will be told, by whom and when, and you should keep a note of what has been agreed together with a copy of any referral form. Check your policy on timeline or referring on to local safeguarding department, usually within 2 days. Remember data protection, so use a secure method of passing information on. Check your referral has been received. Record the dates and times. If at immediate risk of harm, contact police straight away. Ensure that all concerns, advice sought and received, and actions taken are recorded and stored confidentially. Do not store with the patient's optical record. Don't forget to complete normal examination routine, unless too stressful, and refer ocular health issues to hospital clinics as normal. How to report a suspected safeguarding breach. Refer to your organisation's policies and procedures. Report to your manager for designated safeguarding officer. Do not investigate. Do not promise to keep a secret. Keep factual notes and records. Follow your organisation's safeguarding and whistleblowing policies. Signs of staff breaching safeguarding procedures include paying particular attention to a patient or a group of patients, for example, children or adults at risk, inappropriate, non-professional, or over-friendly behaviour with particular patients, going out of their way to see the same patient or recalling them to the clinic without obvious reason, and changing a patient's appointments to fit in with times when they are alone or would not normally be at work. This is a child protection group discussion activity. You are planning a vision screening in a primary school. How will you minimise the child protection risks? In planning the project and in your own behaviour. So for the project, you should ensure there is an adequate staff to child ratio. You should provide adequate supervision of staff and activities. You should minimise opportunities for children to be isolated by a staff member. And you should use open plan spaces. And as an individual, you should avoid situations where you are alone with a child. Never make rude remarks about a child, even as a joke. Do not photograph or video a child without consent of the child and his or her parent or guardian. Avoid unnecessary physical contact. Do not kiss or cuddle, smack or hit. You should keep good communication, and you should know your organisation's code of conduct and safeguarding policies. When safeguarding vulnerable groups, do you need the same considerations if planning a community outreach? What other factors would you need to think about? Yes, you need the same considerations when planning community outreach to protect both children and adults at risk. Minimising risk of harm to children and adults at risk from other patients as well as staff. Other factors you may think about include accessibility, timings so females can attend, advertising via community groups such as albino, women's, disability groups, make provision for the elderly who cannot stand in a queue for long. This is a Protecting Adults at Risk group discussion. You are doing an outreach clinic at a care home for the elderly. One patient says they cannot afford glasses as her nurse has borrowed all her money. It was just a one-off instance, and she will give it back soon. Should you arrange to come back when she gets her money back? Or should you raise this as a concern? You should raise this as a concern and follow normal safeguarding and protection procedures. One-off abuse is still classed as abuse. It may happen again, but even if it doesn't, it is still abuse. Consider, women suffer from over double the amount of blindness and visual impairment. Women and girls access eye care services less than men and boys. Cataract rates are higher in women than in men. Women account for 75% of trachoma blindness. In many settings, women are 2 to 4 times as likely to have trichiasis. Presbyopia rates appear to be higher in women compared with men. Women are often responsible for their children's health care. If they do not have access themselves, it can have an effect on access for children. Women are often not a wage earner, so do not have the funds for eye care, and their families may find it hard to understand why they need corrected eyesight. You need to keep an eye on patient statistics to make sure you have an even spread of male to female adults and child patients, and uptake of spectacles and treatment. Barriers for people with a disability include access, opinions and stigma, communications. We need to think about making our services accessible for all to avoid discrimination. What are some strategies that you can apply to your day-to-day work to help to ensure accessibility for persons with disabilities? What can you do to promote gender equity within your patients? For access, this can include ensuring that there's easy access to services, for example, on the ground floor or using a ramp, conducting vision screenings in aged care facilities, development of low vision services, taking low vision services into the community. Regarding opinions and stigma, do not make assumptions about what people with disabilities can and cannot do. And for communication and interactions, consider the most appropriate type of communication or using multiple modes. For example, verbal and or written, gestures, when giving instructions. Don't assume if someone cannot verbally communicate that they cannot understand, read or write. For gender equity, do regular evaluation of patient statistics, especially male to female ratio, advertise services at women's groups, use both men and women's photos in publicity posters, etc. This diagram is aimed at promoting child welfare but can also be used for safeguarding adults at risk of harm. There are many other elements that make up robust safeguarding. Having a lead person who is trained and can take overall responsibility, having a designated safeguarding officer that staff can approach for advice and report concerns to, a whistleblowing policy, making it safe and easy to report wrongdoing, safe recruitment, training and staff support to help staff understand safeguarding, reporting, child participation, inclusiveness, gender, race, disability, etc. Share practices with other organisations and key staff working alongside yours, and maintain accountability. So your responsibility is to understand your organisation's safeguarding and protection policies and code of conduct and abide by them. To recognise who could be at risk, to know when and to who you can report concerns and how to do it. To learn more about safeguarding and protection of children and adults at risk and local pathways and guidance. Remember your organisation's safeguarding policy when you plan your clinics at the Vision Centre and outreach and see patients. Think about your behaviour during a clinic, an outreach, and with a patient. Are you following your organisation's safeguarding policy? If you see it, if you hear it, if you suspect it, you must report it. In conclusion, safeguarding is the responsibility of organisations to make sure their staff, operations, and programmes do no harm. Child protection is part of the safeguarding process, focusing on protecting identified children. Adult at risk is any adult at risk of abuse or neglect because of their needs for care and support. Responsibility: all individuals working with vulnerable groups are responsible to safeguard and protect. Write down any questions you have about this module and be sure to have them answered. Ask yourself, what am I going to do as a result of this learning? Check that you have achieved the learning outcomes for this module. To know the difference between safeguarding and protection, to recognise what visual impairments and other barriers may cause vulnerability, to understand your responsibility, and to have confidence to raise and report concerns.